1. What is the primary cause of multiple sclerosis, MS? A. Genetic mutations. B. Viral infections. C. Autoimmune response targeting myelin. D. Environmental toxins. Answer: C. Autoimmune response targeting myelin. Rationale: MS is primarily caused by an autoimmune response in which the immune system attacks the protective covering, myelin, of nerve fibers in the central nervous system, CNS. 2. Which clinical manifestation is most commonly associated with relapsing remitting MS? A. Progressive muscle weakness. B. Episodic exacerbations with periods of remission. C. Gradual cognitive decline. D. Persistent visual disturbances. Answer: B. Episodic exacerbations with periods of remission. Rationale: relapsing remitting MS is characterized by periods of symptom flare-ups, relapses, followed by periods of partial or complete remission. 3. A 28-year-old female patient with MS complains of blurred vision and difficulty walking. What is the most likely cause of these symptoms? A. Spinal cord compression. B. Demyelination in the optic nerve and spinal cord. C. Medication side effects. D. Intracranial pressure increase. Answer: B. Demyelination in the optic nerve and spinal cord. Rationale: MS causes demyelination in the central nervous system, CNS, including the optic nerve, leading to blurred vision, and spinal cord, leading to mobility problems. 4. Which diagnostic test is most commonly used to confirm a diagnosis of multiple sclerosis? A. Electroencephalogram, EEG. B. Magnetic resonance imaging, MRI. C. Lumbar puncture. D. X-ray of the spine. Answer: B. Magnetic resonance imaging, MRI. Rationale: MRI is the most effective diagnostic tool for MS as it reveals plaques of demyelination in the CNS. 5. What is the primary goal of disease-modifying therapies, DMTs, in MS treatment? A. To cure the disease. B. To slow the progression and reduce relapses. C. To provide pain relief. D. To manage psychological symptoms. Answer: B. To slow the progression and reduce relapses. Rationale: DMTs are used to modify the disease course by reducing the frequency and severity of relapses, slowing the progression of disability, but they do not cure MS. 6. Which symptom is most common in advanced stages of multiple sclerosis? A. Decreased sensation in the lower limbs. B. Severe headaches. C. Memory loss and cognitive impairment. D. Chest pain. Answer: C. Memory loss and cognitive impairment. Rationale: cognitive impairment, including memory loss, is a common symptom in the later stages of MS, affecting patients' ability to process information and make decisions. 7. What is the most appropriate nursing intervention for a patient with MS who is experiencing difficulty swallowing? A. Provide a soft diet and encourage fluids. B. Administer anticholinergic medications. C. Encourage regular exercise and activity. D. Use a nasogastric tube for feeding. Answer: A. Provide a soft diet and encourage fluids. Rationale: patients with MS may experience dysphagia, and a soft diet with ample fluids helps prevent choking and aspiration. 8. Which of the following is a common risk factor for developing multiple sclerosis? A. Family history of stroke. B. Age over 50 years. C. Female gender and young adulthood. D. Low blood pressure. Answer: C. Female gender and young adulthood. Rationale: MS is more common in young adult women, with peak onset occurring between the ages of 20 and 40. 9. A patient with MS is prescribed interferon beta, 1A Avonex. What is an important nursing consideration when administering this medication? A. Monitor for signs of an allergic reaction. B. Administer with food to reduce nausea. C. Limit the patient's physical activity. D. Encourage the patient to increase. Answer: A. Monitor for signs of an allergic reaction. Rationale: interferon beta, 1A, can cause allergic reactions, including flu-like symptoms and injection site reactions. Monitoring for these is essential. 10. A nurse is teaching a patient with MS about managing heat sensitivity. Which recommendation is most appropriate? A. Take hot showers to relax muscles. B. Avoid high-temperature environments and stay cool. C. Drink warm fluids to improve circulation. D. Engage in outdoor activities during the summer months. Answer. B. Avoid high-temperature environments and stay cool. Rationale. Many MS patients experience a worsening of symptoms when exposed to heat, so it is recommended to avoid high-temperature environments. 11. Which clinical manifestation is often the first sign of multiple sclerosis? A. Difficulty walking. B. Visual disturbances. C. Severe headache. D. Seizures. Answer. B. Visual disturbances. Rationale. Visual disturbances, such as blurred vision or double vision, are often the first symptoms in MS due to optic nerve involvement. 12. A patient with MS complains of difficulty with coordination. What type of MS-related symptom does this represent? A. Spasticity. B. Ataxia. C. Cognitive impairment. D. Dysphagia. Answer. B. Ataxia. Rationale. Ataxia, or lack of coordination, is a common symptom in MS due to the damage to the cerebellum and other parts of the CNS responsible for motor control. 13. What is the pathophysiology of multiple sclerosis? A. Destruction of red blood cells by the immune system. B. Accumulation of abnormal proteins in the brain. C. Progressive demyelination of the CNS. D. Formation of blood clots in the arteries. Answer. C. Progressive demyelination of the CNS. Rationale. MS is characterized by the immune system attacking the myelin sheath of nerve fibers in the central nervous system, leading to progressive demyelination. 14. Which of the following is considered a common environmental risk factor for developing MS? A. High-fat diet. B. Exposure to cold climates. C. Viral infections like Epstein-Barr virus, EBV. D. Smoking cessation. Answer. C. Viral infections like Epstein-Barr virus, EBV. Rationale. Viral infections, particularly EBV, are believed to play a role in triggering MS in genetically susceptible individuals. 15. Which medication is commonly prescribed to manage acute exacerbations of MS? A. Beta interferon. B. Glatiramer acetate. C. Methylprednisolone. D. Baclofen. Answer. C. Methylprednisolone. Rationale. Methylprednisolone, a corticosteroid, is commonly used to treat acute exacerbations by reducing inflammation in the CNS. 16. What is the role of physical therapy in the management of MS? A. It is used to slow disease progression. B. It helps in managing pain and spasticity. C. It focuses on treating the underlying autoimmune response. D. It is used to cure MS. Answer. B. It helps in managing pain and spasticity. Rationale. Physical therapy helps patients manage symptoms such as pain, muscle weakness, and spasticity, and aids in maintaining mobility. 17. A patient with MS experiences a sudden worsening of symptoms. What term is used to describe this episode? A. Progressive phase. B. Relapse. C. Remission.
D. Plateau.
Answer. B. Relapse. Rationale. A relapse, or exacerbation, refers to the sudden worsening of MS symptoms, often associated with demyelination in the CNS. 18. Which of the following is a common complication of MS? A. Hypertension. B. Liver cirrhosis. C. Pressure ulcers. D. Osteoporosis. Answer. C. Pressure ulcers. Rationale. Due to mobility limitations and potential immobility in advanced stages, patients with MS are at high risk for pressure ulcers. 19. Which statement accurately describes the course of secondary progressive MS, SPMS? A. The patient experiences clear periods of remission and relapse. B. The disease gradually worsens over time without clear relapses. C. The patient recovers fully after each relapse. D. Symptoms worsen rapidly in a short period of time. Answer. B. The The disease gradually worsens over time without clear relapses. Rationale: SBMS typically begins as relapsing-remitting MS, but transitions to a steady decline in function without distinct relapse-remission phases. 20. Which of the following is a recommended lifestyle modification for patients with MS? A. Avoiding all physical activity. B. Maintaining a healthy weight and exercise regimen. C. Limiting fluid intake to prevent bladder complications. D. Avoiding any sunlight exposure to reduce symptoms. Answer: B. Maintaining a healthy weight and exercise regimen. Rationale: regular exercise and maintaining a healthy weight help with MS symptom management and overall health, improving strength and mobility. 21. Which test is used to confirm the presence of demyelinating lesions in the central nervous system in MS? A. Electrocardiogram, ECG. B. Magnetic resonance imaging, MRI. C. Computed tomography, CT scan. D. Electromyography, EMG. Answer: B. Magnetic resonance imaging, MRI. Rationale: MRI is the gold standard for detecting the plaques or lesions caused by demyelination in the CNS, which are characteristic of MS. 22. What is the primary reason for using disease-modifying therapies, DMTs, in MS? A. To prevent the occurrence of relapses. B. To cure the disease. C. To provide symptomatic relief. D. To reverse the demyelination process. Answer: A. To prevent the occurrence of relapses. Rationale: DMTs are used to reduce the frequency of relapses and slow the progression of disability in MS, but they do not cure the disease. 23. Which of the following is a common cognitive symptom seen in MS patients? A. Impaired hearing. B. Memory problems. C. Hallucinations. D. Seizures. Answer: B. Memory problems. Rationale: cognitive changes, including memory problems and difficulty concentrating, are common in MS, especially as the disease progresses. 24. Which of the following is considered a trigger for MS exacerbations? A. Exposure to cold temperatures. B. Stress and infection. C. High intake of saturated fats. D. Excessive physical activity. Answer: B. Stress and infection. Rationale: stress and infections are common triggers for MS exacerbations as they can lead to inflammation and immune system activation. 25. A patient with MS is experiencing urinary urgency. What is the most appropriate nursing intervention? A. Encourage the patient to drink fewer fluids. B. Recommend the use of a catheter. C. Provide a bathroom schedule and bladder training. D. Limit the intake of caffeine. Answer: C. Provide a bathroom schedule and bladder training. Rationale: bladder dysfunction, such as urgency, is common in MS. A regular bathroom schedule and bladder training can help manage this symptom. 26. What is the impact of heat intolerance in MS patients? A. It causes worsening of muscle strength. B. It leads to improved mobility. C. It increases fatigue and neurological symptoms. D. It has no effect on MS symptoms. Answer: C. It increases fatigue and neurological symptoms. Rationale: heat intolerance can exacerbate MS symptoms, leading to increased fatigue, weakness, and difficulty with coordination. 27. Which of the following medications is used to treat muscle spasticity in MS? A. Baclofen. B. Methotrexate. C. Carbamazepine. D. Prednisone. Answer: A. Baclofen. Rationale: baclofen is a muscle relaxant commonly prescribed to treat spasticity in MS patients by reducing muscle stiffness and improving mobility. 28. In which stage of MS do patients experience continuous neurological decline without periods of remission? A. Primary progressive MSV, relapsing remitting MSC, secondary progressive MSD, progressive relapsing MS. Answer: A. Primary progressive MS. Rationale: primary progressive MS is characterized by a continuous, gradual progression of symptoms without clear relapses or remissions. 29. Which of the following best describes the role of a nurse in the care of a patient with MS? A. Providing rehabilitation and emotional support. B. Teaching how to cure the disease. C. Limiting physical activity to prevent exacerbations. D. Administering radiation therapy. Answer: A. Providing rehabilitation and emotional support. Rationale: nurses play a critical role in supporting MS patients by offering rehabilitation, education, and emotional support to manage symptoms. 30. Which environmental factor is suggested to contribute to an increased risk of developing MS? A. Living in northern latitudes. B. Consuming high amounts of salt. C. Prolonged exposure to sunlight. D. Regular exercise in hot climates. Answer: A. Living in northern latitudes. Rationale: research suggests that individuals living in regions with lower levels of sunlight, e.g., northern latitudes, may have an increased risk of developing MS due to lower vitamin D levels. 31. Which type of MS is characterized by steady neurological decline from the onset, without any relapses or remissions? A. Secondary progressive MSB, relapsing remitting MSC, primary progressive MSD, progressive relapsing MS. Answer: C. Primary progressive MS. Rationale: primary progressive MS is marked by a continuous decline in function without distinct relapses or remissions. 32. A patient with MS is experiencing a temporary worsening of symptoms after a hot shower. This phenomenon is known as A. Lermite sign. B. Adhoff's phenomenon. C. Babinski reflex. D. Chvostek sign. Answer: B. Adhoff's phenomenon. Rationale: Adhoff's phenomenon refers to the temporary worsening of MS symptoms due to heat, such as after a hot shower or physical activity. 33. What is the primary goal of disease-modifying therapies, DMTs, for MS? A. To cure MS. B. To decrease the number of relapses and slow disease progression. C. To eliminate all symptoms permanently. D. To reverse the effects of demyelination. Answer: B. To decrease the number of relapses and slow disease progression. Rationale: DMTs are used to reduce the frequency of relapses and to slow the long-term progression of disability in MS patients. 34. Which of the following is a non-pharmacological intervention that can help manage fatigue in MS patients? A. Complete bed rest. B. Avoiding exercise. C. Energy conservation techniques. D. Increasing caloric intake. Answer: C. Energy conservation techniques. Rationale: energy conservation strategies, such as taking regular breaks and pacing activities, can help manage fatigue, a common symptom in MS. 35. A 45-year-old patient with MS is experiencing difficulty swallowing. This is known as A. Dysphagia. B. Dysarthria. C. Ataxia. D. Apraxia. Answer: A. Dysphagia. Rationale: dysphagia refers to difficulty swallowing and is a common issue in MS due to impaired motor control in the mouth and throat muscles. 36. A patient with MS reports vision changes, including double vision and blurry vision. Which cranial nerve is most likely affected? A. Optic nerve, cranial nerve 2. B. Trigeminal nerve, cranial nerve V. C. Oculomotor nerve, cranial nerve 3. D. Facial nerve, cranial nerve 7. Answer: A. Optic nerve, cranial nerve 2. Rationale: vision problems such as double vision and blurry vision are typically associated with optic nerve involvement in MS. 37. What is the effect of high doses of corticosteroids during an MS relapse? A. They prevent further demyelination. B. They reduce inflammation and shorten the duration of the relapse. C. They cure the disease. D. They permanently stop MS progression. Answer: B. They reduce inflammation and shorten the duration of the relapse. Rationale: corticosteroids, such as methylprednisolone, help reduce inflammation during MS relapses, shortening the duration and severity of the episode. 38. Which of the following symptoms is commonly associated with multiple sclerosis and often affects the patient's ability to walk? A. Spasticity. B. Photophobia. C. Nystagmus. D. Anosmia. Answer: A. Spasticity. Rationale: spasticity, or muscle stiffness, is common in MS and often affects the legs, making walking difficult for patients. 39. What is Lermite's sign, commonly seen in MS patients? A. A sudden electric shock-like sensation down the spine when bending the neck. B. A tremor in the hands that occurs during movement. C. A sensation of dizziness and nausea. D. A loss of vision in one eye. Answer: A. A sudden electric shock-like sensation down the spine when bending the neck. Rationale: Lermite's sign is a characteristic symptom of MS where patients experience a shock-like sensation in the spine when they bend their neck. 40. Which of the following is a common emotional symptom associated with MS? A. Increased irritability.
B. Euphoria.
C. Depression. D. Mania. Answer: C. Depression. Rationale: Depression is a common emotional symptom in MS, likely due to both the chronic nature of the disease and neurological changes in the brain. 41. Which MS medication is commonly used to manage chronic spasticity? A. Interferon beta. B. Glatiramer acetate. C. Baclofen. D. Dimethyl fumarate. Answer: C. Baclofen. Rationale: Baclofen is commonly prescribed to manage spasticity, a common symptom of MS, by relaxing the muscles. 42. What is the most effective way to prevent pressure ulcers in patients with MS? A. Implementing a daily stretching regimen. B. Keeping the patient in a seated position for long periods. C. Performing regular repositioning and skin assessments. D. Avoiding fluid intake. Answer: C. Performing regular repositioning and skin assessments. Rationale: Repositioning the patient regularly and performing skin assessments can prevent pressure ulcers, especially in patients with mobility limitations in MS. 43. Which diagnostic test is most commonly used to diagnose MS? A. CT scan. B. EEG, electroencephalogram. C. MRI, magnetic resonance imaging. D. PET scan. Answer: C. MRI, magnetic resonance imaging. Rationale: MRI is the most commonly used diagnostic tool for MS as it can reveal plaques or lesions caused by demyelination in the CS. 44. Which of the following factors may increase the risk of developing MS in genetically predisposed individuals? A. Exposure to direct sunlight. B. Smoking. C. Increased physical activity. D. A high-fiber diet. Answer: B. Smoking. Rationale: Smoking has been linked to an increased risk of developing MS in individuals with a genetic predisposition to the disease. 45. A patient with MS is experiencing sensory disturbances, such as numbness and tingling in the arms and legs. Which part of the nervous system is most likely affected? A. Peripheral nervous system. B. Autonomic nervous system. C. Central nervous system. D. Somatic nervous system. Answer: C. Central nervous system. Rationale: Sensory disturbances in MS are typically due to demyelination in the central nervous system, CNS, affecting the transmission of sensory signals. 46. In MS, which of the following symptoms is most likely caused by damage to the cerebellum? A. Memory loss. B. Ataxia. C. Visual disturbances. D. Incontinence. Answer: B. Ataxia. Rationale: Ataxia, or lack of coordination, occurs due to damage to the cerebellum, which is responsible for motor control. 47. Which of the following is an autoimmune response in MS? A. Destruction of myelin in the central nervous system. B. Increased blood clotting in the veins. C. Inflammation of the gallbladder. D. Degeneration of bone tissue. Answer: A. Destruction of myelin in the central nervous system. Rationale: MS is an autoimmune disorder in which the immune system attacks and destroys the myelin sheath that covers nerve fibers in the CNS. 48. A patient with MS reports an inability to control urination. This is an example of which type of MS symptom? A. Cognitive dysfunction. B. Sensory disturbances. C. Bladder dysfunction. D. Visual impairment. Answer: C. Bladder dysfunction. Rationale: Bladder dysfunction, such as urinary urgency or incontinence, is common in MS due to nerve damage affecting bladder control. 49. Which of the following is considered a first-line treatment for relapsing forms of MS? A. Baclofen. B. Methylprednisolone. C. Interferon beta. D. Methotrexate. Answer: C. Interferon beta. Rationale: interferon beta is a disease-modifying therapy, DMT, that is commonly used as a first-line treatment for relapsing forms of MS to reduce relapse frequency. 50. Which of the following is not a typical symptom of MS? A. Muscle weakness. B. Tremors.
C. Jaundice.
D. Difficulty walking. Answer: C. Jaundice. Rationale: jaundice is not a typical symptom of MS, which primarily affects the CNS. Symptoms of MS include muscle weakness, tremors, and difficulty walking.